Hi, let's talk about the pelvic diaphragm and the perineum. The pelvic diaphragm is a series of muscles which supports the pelvic viscera and resists intra-abdominal pelvic pressure. So the two major components of the pelvic diaphragm are the levator ani muscle and the Iliococcygeus muscle, sometimes just referred to as the Coccygeus muscle. Now, the levator ani muscle is going to extend from anterior and lateral aspects of the bony pelvis to posterior and lateral aspects of the bony pelvis. So much of this we cannot see because it's obscured by features of the urogenital triangle, so namely the perennial membrane and ischiocavernosus, bulbocavernosus muscles, as well as transverse perennial muscles, which we can see all throughout here. But we can see some of these muscles. Let me just outline the external anal sphincter for us here. So let's start with the more medial fibers of levator ani. And these include the puborectalis muscles. So the puborectalis muscles are going to form a sling around the anorectal junction. So if you recall, the rectum is a little more anteriorly facing, and the anal canal is more posteriorly facing, owing to this sling that's placed on it. So these fibers are originating from the posterior aspect of the pubis and then meeting their counterparts around the anorectal junction. There are also the pubococcygeus muscles. The pubococcygeus muscles are running from the posterior portions of the pubic bones as well as the ischiopubic rami. There's somewhat of a condensation of connective tissue called the tendinous arc of levator ani that those muscles are going to originate from, and they're coming back to insert on the coccyx and some of the connective tissues of the Iliococcygeal raphe, which is going to run between the anal canal and the coccyx. The third and final part to the levator ani muscle are the Iliococcygeus muscles. The Iliococcygeus muscles are originating from that tendinous arc of levator ani and coming together to insert on the coccyx and that Iliococcygeal raphe. And you can see there are fibers running this way. And then finally, to round out the pelvic diaphragm, we have the Iliococcygeus muscles. The Iliococcygeal muscles are more wedge shape, and they run from the ischial spines, and there's actually connective tissue there that is part of that tendinous arc of levator ani. And they're coming together along the midline on a little bit of the sacrum, largely on the coccyx, which we can see here, and a little on that Iliococcygeal raphe. So here we have the levator ani and Iliococcygeus muscle. When we think of the perineum, we need to think of all of these structures which are superficial to that pelvic diaphragm. Let's review the boundaries of the perineum. So anterolaterally, we have the ischiopubic rami. Posterior laterally, we have the sacrotuberous ligament. So we can see that the coccyx is invading that space as well. And separating two triangles here, we have an interischial line, which anteriorly separates the urogenital triangle from posteriorly the anal triangle. That urogenital triangle is going to host the urogenital hiatus, which is this space here. That urogenital hiatus is the space through which the urethra and the vagina are conveyed. Surrounding that space, we see some bulbospongiosus muscle. Now, the anal triangle is going to host the external anal sphincter, which we can see there. And it's where fibers of that external anal sphincter and bulbospongiosus muscle, as well as the transverse perennial muscles, are going to come together in that musculotendinous intersection, which is known as the perennial body. That perennial body is a site of central support that is common between the urogenital and anal triangles. So over here we can see some donors with the skin intact, and I can just roughly draw for you the boundaries of the perineum here, so that we can have an appreciation for the superficial tissues and how they relate to the perineum, like so. We can also see that that structures that are part of the vulva or external female genitalia are part of the perineum, as are structures of the penis, inclusive of the scrotum. So we've discussed the pelvic diaphragm and the perineum. Thank you very much for your time.